we have to be ready. And we have to be able, from the grassroots, to recognize signs of disease and signs of pandemic. We shouldn't deny. We should listen to healthcare professionals. We should practice awareness, and we should practice prevention.
Hello, this is Marco Rock. Welcome to Marco Rock TV. My name is Marco Rock. I'm your host for Inside a Great Mind, where we interview entrepreneurs, leaders, game changers, and achievers for the purpose to inspire and inform you. Today, like any other day, we're so thrilled for our guest, Dr. Ali Maman. How are you?
I'm doing great. How are you?
We've been trying to do this interview for months. I'm glad we can make it happen today, right?
It's very difficult, as you know, at this time when we deal with what is important.
Yes.
But I'm glad.
Yeah, we make it. So tell us, who is Dr. Ali Maman?
So my name is Maman.
Yeah.
And last name Ali, obviously. And I am physician and primary care physician particularly, and originally from Niger, a country in West Africa.
Okay.
And moved to Omaha in 2001 and started my endeavor of being a primary care physician by joining the University of Nebraska Medical Center, where I trained both in family medicine and internal medicine.
Awesome. So you moved here in 2001, you say, to the US.
Correct.
Yeah, and then what sparked you to become a physician, and what was that journey look like?
There is probably no one answer, probably multiple answers. And among the answers, wanting to see our community healthy and going back to health for sick people. And since my childhood, I was interested in helping people just to feel better, even among my family, where I play usually with my peers and friends and family members, where I play
like
the doctor's role.
Okay, I can imagine that. So was it a tough process for you, kind of from different countries, going through that process?
Yes, you can imagine Niger being a French country.
Yeah.
So obviously language would be the first barrier. And culture would be probably another one.
Yeah.
And going through the system also, juggling studies with family also has not been an easy thing. But at the end of the day, I think when you set your mind for a goal, things are achievable.
So you're the owner of a clinic?
I'm the owner of Miracle Hills Clinic.
Okay.
Correct.
What was that transition, being an employee and then deciding to shift to have your own practice?
I always wanted to be a leader, entrepreneur,
Okay.
and someone who can think outside the box and provide the best care to my patient as I envision to be. For that reason, I try to stay away from the mainstream corporate organizations and decide to do my own organization where I can deliver the best care I think our people deserve. That was my number one reason for opening the clinic.
What would be the second reason?
The second reason would be probably more independence,
Okay.
flexibility, and as a family member, I value time with my family, time with the kids, and staying around the table and listen to my kids every afternoon or every night. So therefore, working for myself gives me that flexibility.
Flexibility.
Correct.
You value primary care. Why?
I value primary care.
Why?
I value primary care. That is beautiful aspect of medicine in my opinion.
Okay.
It's good to treat disease. It's always good to see someone feeling better. But you know what is even better?
No.
To prevent people from being sick.
Okay.
Therefore, primary care have become and are and stay and they will remain the front gate for preventive medicine and healthcare promotion. Therefore, I believe everyone should have a primary care physician.
Who should have a primary care physician? I mean, I would agree to that.
I do. I also have a primary care physician.
Yeah. Okay.
Yeah.
So now talking about preventive health, do you think we as a society doing a good job preparing ourselves, on the mechanism or the things that we should be doing to stay healthier?
So prevention is not a monolithic concept in healthcare. As you can envision, preventing disease from happening would take a lot from the patient himself, from the community at large, and from the doctor. Everybody has to play a role to kind of fill in the boxes and move to better society, better community, and better patient. And in general, better healthcare system. So by saying that patients have to listen to physician in terms of asking the best questions and listen to the physician after education for better health. For example, one should not smoke. A patient should do everything to prevent diabetics from happening. A patient should do everything to prevent hypertension from happening if the patient is predisposed to have hypertension. That should be an active role for the patient to play. The physician provides the information, the education, the tools probably, and the patient does the work. At large, the community create a template and awareness for patients to have access to medical care, and the physician and the patient work together to achieve the goals.
So we live in a very challenging time right now with COVID-19. What are the lessons that we can get for these things that's happening in terms of healthcare, in your opinion?
In my opinion, the lessons we should get from this situation is, number one, we have to be ready. And we have to be able, from the grassroots, to recognize signs of disease and signs of pandemic. We shouldn't deny. We should listen to healthcare professionals. We should practice awareness, and we should practice prevention. That's my opinion. That's, I think, the biggest lesson, and among everything else.
Okay, when it comes to us, like me, for instance, what are the things that I can be doing, for instance, to stay healthy? Things that we may know the answer, but sometimes we need to be reminded again that, hey, you need to do X, Y, Z. What are the things that you can tell me today that I need to do to stay healthy on the aspect of the preventive health?
So again, patients themselves, they have to play an active role in their health. Staying healthy starts from the basics. We all have to have proper nutrition. Food is important, but moderation is important, selection is important, and regular nutritious food is important. Smoking, unfortunately, is very prevalent in our society. Better sleep, good night's sleep, also helps your immune system to stay healthy and keep your internal clock in check in order to stay healthy and have good immune system.
But you know that most of the time we're trying to neglect that sleeping part, right?
Exactly.
You know, because we're so busy, and then you think like, you can sleep for 3 hours and then you're
absolutely.
good.
So for any disease, for any condition, sleep is important.
So I want to go back to the thought of eating right. So how important, like, what we eat? You talk about selection of the food. You talk about eating like a moderate, like, can you emphasize on those two aspects, the selection and eating with moderation?
So we all have need based on our energy expenditure.
Okay.
And based on those needs, we also have body habits, and we have also access. If access is possible, everyone should have significant amounts of protein, up to 2/3 of portion, 1/3 of carbohydrates or energy source from carbohydrates, and 1/3 source of energy from fat. Therefore, keeping equilibrium in terms of what you bring as source of energy. But it doesn't limit there. You have to have sufficient amount of water. You have to have sufficient amount of micronutrients, meaning you need to have significant amount of fiber, fruits, from fruit and vegetables. Correct.
Okay.
That is considered basic of what we consider good nutrition. Avoid overeating and eat regularly as our culture dictates, usually 3 times a day.
3 times a day.
Avoid snacking if you can.
I'm guilty for that. I love snacks. I'm just like a person who will just could grab these 2 or 3 times.
Unfortunately, I see patients when they come to the office and we're working so hard to get them back to healthy weight. They say, "Doctor, I don't even eat. I don't know where all this weight coming from."
Okay.
It must be coming from somewhere. Most of the time, I say, sit down and look over. Challenge yourself and do your diet dairy for the day.
Okay.
They found out they usually snack around 8:30 after breakfast. They snack at 10:30 before lunch. They snack at 2:30, 4:30 before dinner. They snack while watching TV.
I don't snack that much. I don't snack that much.
And they also snack before bedtime. Oftentimes they wake up late at night
And they snack.
and they snack
I
again.
don't do that, actually, to be honest with
You can imagine on top of 3 meals,
Yeah, you have all those snacks.
you have all those snacks. Unfortunately, when we snack, we have a bad habit of snacking on unhealthy food. Carbohydrates,
Yeah.
raw sugar,
I see.
sometimes with chocolate and candy,
Alright.
etc.
I will I will make sure like I don't snack that much, to help you.
Well, you look well fit, so I don't know what you've been doing right. Well, you have to share with me after this,
Okay.
after this conversation.
All right. So if Dr. Ali Maman have a power to make one positive change in the world right now, what would that be?
I would promote preventive health and health promotion. We found out actually found out not too long ago from the International Healthcare Journal, states in the United States where we have good statistics that have more primary care physician per capita have the best outcome in terms of preventing cancer, cardiovascular disease,
Okay.
chronic lung disease, among other top cause of mortalities. That tells everything. If we invigorate the primary care as gatekeeper for disease and as health promotion and preventive care soldiers, I think our healthcare system will benefit from removing all the burden of cost, inefficiency, bureaucracy, pharmaceutical consumption, and everything else. That is my belief.
If you were to be an animal, what kind of animal would you want to be and why?
I'm the best animal I know.
I never heard this one before.
I don't know if you believe we're also animals.
What would be your last advice tip to my audience?
Number one is everyone should have a primary care physician, like I said before.
Okay.
Second advice would be we have to play our roles to stay healthy. And staying healthy, like I said also, is going to be just a reminder. We have to stay actively involved in our health care, in our health,
Okay.
by avoiding smoke, toxins, eating healthy, sleep well, avoid or minimize stress, and live a happy life within family.
How can people find more information about you if they want to reach out?
If you want to reach out, the best way might be to probably check to our website www.miraclehealthclinic.com. And I'm really appreciative for your visit, and it was a pleasure to chat with you and discuss about our healthcare and where we are today in our healthcare.
It is a pleasure. Thank you, Dr. Ali.
Thank you very much.
Awesome.